Hello, and thanks for joining us for this video case tip. I'm Bryn McBride of ABC for Health. Today, we're taking a quick look at CHIP reauthorization. We'll explain what that is in just a second, but first, we do have some links that you might find interesting that you can visit at any time by clicking on that information button you see at the bottom of your screen. Let's go down memory lane a little bit and revisit some history. The Children's Health Insurance Program, CHIP, was enacted back in the 90s, 1997, under the Social Security Act, which was designed to give health coverage to children that were from low to moderate income families. It flew just above Medicaid eligibility and gave Medicaid benefits to children in a way using different federal funding, not Title 19 funding, more Title 21 funding, in a way to make sure that kids were connected to health care coverage, knowing that that bright line that existed for Medicaid eligibility was leaving some kids off that were right at the barrier. Then First Lady Hillary Clinton was very instrumental in making sure that CHIP became a reality, and it had bipartisan support. In Wisconsin, CHIP is part of BadgerCare Plus. This is why BadgerCare Plus extends to 306% of the federal poverty level in eligibility, whereas parents and adults are at 100%. The way that Wisconsin runs BadgerCare Plus is to mix in a little of the CHIP money and the Medicaid money to be able to offer enhanced services and eligibility for children. Nationwide, this is covering between 9 and 10 million children annually. So what's happened? Since 1997, CHIP has had to be reauthorized. In 2009, CHIP became CHIPRA, the Children's Health Insurance Program Reauthorization Act. That extended CHIP funding and the eligibility through September of 2017, but that's when it was set to sunset. That means that CHIP funding and eligibility will end at the end of September 2017 unless Congress will go back and reauthorize it again. You can see it's on a 10-year cycle. We're at the point now where Congress has to reauthorize CHIP or it will end, and they have not done anything. There has been Senate Finance Committee meetings on the calendar to take up this issue, but they have been rescheduled and they've been essentially canceled. So we're coming up where we've got a deadline to meet, and action has to start now. We're within 90 days of the sunset. Action has to happen now, or we could be saying goodbye to the CHIP program. The National Governors Association is one of the many groups that's starting to get nervous. They actually penned a letter to the bipartisan letter to the Congress urging them to at least do an extension while they get the details worked out, but to not end the CHIP program. Like we said, this has been providing millions of children with health coverage over the last 20 years. It's had wide bipartisan support. The governors have been very vocal. And in this volatile political environment, it's anybody's guess if this program is going to continue. Like we said, we've got less than 90 days until this runs out. You can read that National Governors Association letter to Congress where they stress the importance of continuing the program. And we here will continue to keep you posted as we get closer to that September 30th deadline. Thanks for joining us.